Welcome to the Futurist Society Podcast, where we delve into the latest advancements in technology, science, and culture. From discussions on the latest breakthroughs in AI, biotechnology, and space exploration, the Futurist Society is your window into all of the awesomeness that the future holds. Get ready to be informed and inspired as we consider the positive impact of emerging technologies on humanity. Without further ado, welcome your host, Dr. Awesome.
Hey, everybody. Welcome back to the Futurist Society, where we are talking in the present, but talking about the future. As always, I have a really amazing guest for you today, a leader in the biotech space, Dr. Joseph Beyene, who is the co-founder of Nanoplex. And he has some pretty interesting takes on what biotech is right now, what he hopes it's going to be, and also some interesting things that he's doing with his company, which is trying to combat tick-borne diseases, which are a big problem. Whether you know about somebody with Lyme disease or whether you know about some of these other rare issues that ticks often cause in the human population, it's something that I see relatively routinely. But tell us a little bit about what you're doing over there at Nanoplex, Joseph, and like how you got into this field.
Awesome. And thank you, Dr. Awesome, for having me. At Nanoplex, we envision a world where tick-borne diseases no longer cause the $18 billion in global livestock damages to the global livestock economy, and where people have a solution for not suffering for the long-term effects of Lyme disease. So I got into this field because I was helping build the first research consortium focused on Lyme disease. And when I gathered the physicians and investigators together to do this project to really move and advance the field, I started seeing how can I contribute and give hope to patients who didn't have hope. And what I realized is that we could create a topical solution that prevents the spread of all tick-borne diseases by being the first company that specifically targets and disrupt tick feeding physiology. And so this is our way to prevent the spread of all tick-borne diseases. And we're extremely excited about the potential of the product we're developing. And I'm excited for us to work together to have a solution for this problem that affects so many people and animals worldwide.
Awesome, man. Well, like I commend you for what you're doing. I think that people don't realize like the amount of insect-borne diseases just in general, and also the novel ways of treating these things. Like, for example, a lot of different countries are using genetically modified mosquitoes to eradicate things like malaria and some of these other different insect-borne diseases. Tell me a little bit about what your focus is going to be in regards to administration and how that's going to decrease the likelihood of somebody getting a disease like Lyme disease or some of these other tick-borne diseases.
This is a great question. So the majority of solutions for tick-borne diseases are these neurotoxin-based acaricides. So they're meant to be broad usage, right? For both ticks, insects, of different types of vectors for diseases. But what we're doing that is unique is that we are disrupting conserved mechanisms of how ticks attach and feed on both humans and animals. So we're developing a topical solution that will prevent this attachment mechanism and thereby prevent the feeding and dissemination of tick-borne diseases. So this is the unique way that we're approaching this problem. But even deeper than that is by preventing the blood meal from ticks, you potentially reduce on an exponential level the amount of ticks because they need the blood meal to reproduce 3,000 to 5,000 eggs they create, So we're very excited about using novel mechanisms of bioengineering, bioadhesives to have a solution to this problem. This has never been really approached from this perspective before. So we're combining a novel approach with a huge unmet need in both the livestock industry and humans.
So why ticks? Do you know somebody with Lyme disease? Is there a particular reason why you chose this vector as opposed to other different things? Like is your background in insect-borne diseases? Tell us a little bit about why you chose ticks.
This is a great question, Dr. Awesome. I'll take a step back. When I first got into graduate school, I was described as an undifferentiated stem cell because I get excited about challenging problems. So how did I get into ticks? Well, when I helped build the first research consortium focused on Lyme disease at Harvard Medical School, to be quite honest, I had no background in infectious disease research or tick biology. But I educated myself on not only the biology of the disease, but the sociology of the disease, the political levers of the disease. And it reminded me of my experience as a historically marginalized person, with people not getting the answers from the medical establishment, people not having answers to their scientific questions. So I saw this as a way to leverage my scientific acumen to give hope to patients and answers to the illnesses that they're dealing with when it comes to tick-borne diseases. So it was serendipitous in how it happened. And I want to run through a wall to solve this problem and leverage the treasure trove of biology and tick saliva to create solutions for both humans and animals.
Yeah, I think that, I have a lot of patients that come in with Lyme disease, and I don't think that people realize, like, just because you have a diagnosis doesn't really mean that you know anything about it.
Mhm.
I feel like the amount of stuff that we don't know about lots of different diseases could dwarf the amount that we do know, especially in regards to Lyme disease. Like, it affects every organ system in the body, right? Like, I mean, if you have a Lyme disease patient, like I would have to worry about their heart, I'd have to worry about their kidneys,
Mhm.
their liver, every single thing. And it's crazy that it just started from like them out in the woods, just getting bit by a tick, unnecessarily, right? And that's only, I think, the starting nucleus for all of the things that the ticks carry. So I didn't even really think like, oh, let's take a step back and go back to the vector of the disease rather than just treating the disease itself. And I think that that's something that I've recently come into understanding. That's how they're treating malaria in a lot of developing countries. They're trying to focus on the mosquitoes. And that's one of the things that I think that was novel. So has this been something that is a relatively new concept, or is this something that they've tried in the past and it hasn't worked? Like what are you innovating in regards to the therapeutics that are currently available?
To answer your question, this is a very new method of approaching the problem at the root, right? We're not trying to perturb the neurotransmitter signaling in all insects that are broad use. There's nothing that is bespoke to ticks on the market. There's nothing that says, how do we disrupt conserved mechanisms of tick feeding? So the way ticks glue themselves to you is the way we're trying to perturb this process of disease transmission. And so right now we're still developing our proprietary compounds to achieve this mechanism. But what I'm happy to say, Dr. Austin, is that we have collaborative support for Brigham and Women's Hospital, for which we're doing this project with renowned founder Jeff Karp. And also, we have support from the USDA Cattle Tick Fever Program to support our commercialization efforts to really curb this issue.
What is the focus on livestock? Why is that important?
Great question. Tick-borne diseases affect over 80% of the global livestock population. They've caused between 15 to 18 billion dollars in livestock damages. So you can imagine all the governments and farmers that are eager for a solution that curb the spread of tick-borne diseases and the effects that they're having on livestock. So many governments rely on livestock husbandry for their global sustenance. So I saw this as a way to solve the problem, not only for animals, but also for global economies that rely on livestock for their sustenance. So I see this as a way of not attacking livestock, but preventing tick-borne diseases, transmission to livestock, so that we could both ameliorate the condition of animals, but also global economies that rely on these mechanisms for their health.
Yeah, I can see it being certainly lucrative because, livestock are such a big proponent of our economy. We all eat meat. Well, sorry, that's not true. We don't all eat meat, but a lot of people eat meat. But I guess my question to you is, how is it done? Like, you're saying it's an adhesive or some sort of like something that's put on topically, or what is the mechanism of it?
Right. So what we're trying to do now is develop the actual modality, right? We're not sure if this is going to be a cream, a spray. In the context of livestock, is it going to be a pour on? So we're trying to understand exactly the delivery modality. We're still working out the details, so I can't speak to the exact mechanism by which we're doing this. But what we are doing is targeting the natural adhesive substances tick uses to transmit disease. And mechanism has never really been focused on before and interrogated. And you can, and even in the tick field itself, people aren't thinking about this, because when I first conceptualized this idea, it wasn't really, it was like, wow, we never thought about this way before. That's why I ran with it. And,
Hmm.
these are the types of things that excite me, thinking outside the box
Hmm.
and how to address problems in a new way, in a novel way, in ways that people might think are kind of crazy. So what we're doing is very unique and, has been validated with some preliminary work that I'm
Hmm.
excited to talk about in the very near future.
Nice. So I want to zoom out and just talk about biotech in general. We're in Kendall Square right now, which I think is one of the biotech hubs of the entire world, right? And it's something that's just really had such a significant impact on our lives. Like the Moderna headquarters developing a vaccine for the pandemic just a few blocks from us, to now CRISPR being used and all these different things. Like, is the, I guess, lesser known vectors like tick-borne diseases, like, is there still like a lot of excitement the same way that you're seeing in regards to excitement and around like longevity, around DNA modification to cure these diseases? Is it something that biotech as a whole is kind of being pushed up by, or is it only specific use cases that where a lot of the excitement is coming from?
Right. What I'm very much excited about in biotech and what I see the future of biotech really, going towards is the use of biomimetic approaches, re-engineering nature to develop novel therapeutics. And when you ask about an underappreciated area, tick spit or tick saliva is a treasure trove of immunobiology, which I plan to leverage as a new class of immunomodulators. What do I mean? We have these great treatments like CAR T cell therapy, right? And the promise of allogeneic cell therapy, which is essentially off the shelf T cells that can be engineered to fight cancers, right? But a lot of problems with that is that there's immunogenicity, right? There's problems with growth, graft versus host disease. So most immunosuppressants suppress the entire immune system. But what if you could create a targeted approach where you could develop a therapy without the unwanted side effects of the immune system? Tick saliva has a cocktail of bioactive compounds that numb your pain responses, numb your itch responses, numb your adaptive and your innate immune responses. So right now I'm working on leveraging those tools, biomimetic approaches, to create these immunologically privileged micro niches, essentially a way where we can numb the immune system where it needs to be numbed and stopped and create therapeutic effects. So that's my long-winded answer to your question is I see the future of biotech moving towards these biomimetic approaches because nature's already doing these things. Why not repurpose this for innovative technologies in medicine? And so I'm incredibly excited about the future.
Yeah, I mean, I think that it's kind of like the old becoming new again. I feel like when you're talking about biomimetics, it's something that like was used in maybe like the 50s or so to engineer new drug compounds, like even penicillin, right? It's a direct response from the fungi that were able to combat bacteria. And so I hope that you're right. I feel like there's so many different chemical compounds that are out there that we don't know about. And I hope that some of these things are going to be repurposed. But I guess my main question is that like I just personally as an outsider that's not in this field, like I see a ton of popularity in the biotech industry right now, and
Right.
more so that I think than I can remember, and maybe that's just because I'm naive because I'm an outsider looking in. But other than just like pharmaceuticals, I mean, there's things that are coming up in the news every day that I think are revolutionary. Like, I
Yeah.
mean, like the idea of like treating aging as a disease. I mean, I people walking on the street that have no real knowledge of medicine or anything like that, like they are excited about that, right? Like, I mean, I was talking with a writer a few weeks ago, and he was saying about how excited he was that like he could potentially live to be 150, right? And like that's something that is spread throughout the consciousness of the nation, right? It's something that is really interesting, and it's a direct result of the biotech industry, and honestly happening within the few blocks that are around us here in Kendall Square. I just don't know if like is that same kind of investment, is that same kind of attention happening to lesser known diseases? Because I feel like it is. I just don't know that if it is, because I see the cure for sickle cell, for example,
Mhm.
right? Like they have this new CRISPR deletion such that you can remove the gel, or sorry, the DNA that causes sickle cell, and then these people have the ability to live a normal life afterwards, right? And it's obviously a very expensive treatment, but man, like, I mean, you're basically curing this person's innate genetic issue. And something like that is kind of niche, but it's something that's super popular. And I don't know if like behind the scenes there was like a lot of popularity of it, and then now it's like out in the public consciousness. Like, is that stuff happening with like lesser known diseases like Lyme disease also, or is it like is the rising tide lifting all boats, or is it just there are certain things that are more popular than others?
That's a great question. Unfortunately, I would say it's the latter, right? Infectious disease, vector-borne diseases, people are not looking at the revolutionary potential of these different, ways pathogens are transmitted, how we can leverage them for human use. But we are excited about the developments in therapeutics, especially when you talk about CRISPR, which was ironically adapted from the bacterial immune system and leveraged for human purpose. So we're doing this with bacteria, but when it comes to, vectors like mosquitoes and ticks and different vectors, these things have been sort of underappreciated.
Mm-hmm.
What's great about, cell therapy, what CRISPR Therapeutics is doing to sickle cell is really editing that gene that you mentioned that causes the cell to sickle and have a normal cell. Even in this context, there's a huge need, right? During this time where these cells are being prepared, the patient doesn't have an immune system because it needs to be repopulated. So companies like Beyene Therapeutics that are doing base editing, that are figuring out ways to condition your immune system so you're destroying the disease cells, but you're also keeping the healthy cells while you're waiting for your transplant. So in terms of innovation, companies like Beyene Therapeutics are doing base editing as opposed to CRISPR, which is sort of editing a whole locus of the genome. It's quite innovative. So these things continue to evolve and get better. But that's my long-winded answer to your question where, I don't think, all ships are rising. I still feel like other platform technologies that target diseases that have a larger population are being sort of focused on. But I'm always looking at the diamonds in the rough and what are those things we haven't really, explored to see how we can answer a lot of these unmet needs in terms of immunogenicity of drugs and conditioning regimens for patients who wait for cell therapy.
Yeah, I mean, I have a tangential appreciation for translational research because I interact with a lot of research people through my podcast and also through my career. And so I feel like all of them have this kind of like pioneer mindset, right? Like, I'm going to go and I'm going to figure this thing out that nobody's ever figured out before, which is awesome. I just want I feel like when I see all of these amazing things happening, I feel like CRISPR in my mind as an outsider looking in has changed the game, right?
Yeah.
And so now that we have this huge game changer, I would hope that all of the different life sciences are being reevaluated in regards to their potential for profit or even helping humanity. I think that when I look at like AI, right, like artificial intelligence, it's like you can just like put AI on like your company name and like your stock goes up, right? Like, and I see just like people just like throwing money at this thing, right? And for really marginal benefit, like I mean, I don't really feel like it's impacted my life the way that I think that it's impacted like the lives of somebody that has been cured of their condition of sickle cell, right? Like so I think that I would hope that there's a lot more investment coming in biotechnology just because of like the amazing advancements that are happening, but I just don't see if that's possible. And I hope that through this podcast people will realize that like maybe we should take a chance on something that might not be as popular, right? Like I feel like all the money is going to longevity right now, and so, which is great because I also want to be living to 150. Like, it's not something that I think should be just exclusive to like billionaires and everybody like that. But I hope that more investment comes into this, because I can tell you Lyme disease is a huge problem, and if that's something that can be fixed, or if the idea of having livestock that don't have to be treated for tick-borne diseases, like I think that would be a big issue. I just don't know if like the same kind of investment is happening because all this other investment is happening.
Right. You hit the nail on the head, right? These aren't the popular, cost drivers to the public, right? But once you open the hood, you see just the staggering effect these things have on the global community. So you're right. Unfortunately, biotech is a business, and these diseases that are affecting larger populations that have cost margins
Hmm.
that have been proven in the past are the ones that are getting invested in.
Hmm.
And there's been some huge advancements, but I mean, with government initiatives, in theory, funding is being provided for more of these lesser known issues that are affecting huge populations around the world. And I want to be a conduit for that to give hope to these people who don't have access.
Yeah. And one of the things that we talked about in regards to access is just like access in general to the biotech industry, right? I mean, that's something that aside from you developing this novel therapeutic, like that's something that you're a big proponent of. Tell us a little bit about how you came into this space, into the industry itself, and why you feel like it's super important for everybody to have access to it.
Right. I've always felt that there's not a access to innovation and entrepreneurship. It's always been a pipeline issue, not a talent issue. And so I feel like my story is if of that nature, and I want to open doors for others. So how did I get into biotech? Well, during my graduate training, like most scientific discoveries, we discovered a novel subset of extracellular vesicles. You're like, what are those? Well, these are like bubbles that are secreted. Imagine a kid blowing a bubble at a party. Well, we found that your cells secrete these same bubbles. Who cares, right? Well, we found that HIV uses the same process to bud from the cell that your own cells use to make these bubbles. So we said, hey, if these bubbles act like a virus in how they get out of cells, what if they act like a virus in how they get into cells? And if they do, why not package them with potentially therapeutic molecules? So this is how I got into biotech and company creation. I led a collaboration between two labs at Harvard where I characterized their homing ability in the composition of these vesicles we call ARBs. And that became a company called Vesigen TX that got a $28 million Series A investment from Leaps by Bayer and Alexandria Ventures. So this is how I got bit by the bug to say, hey, I want to create companies that have solutions that major unmet needs. And so this is my exposure to biotech, and I've just been running with it ever since.
But one of the things that I've seen in the news recently is that specifically here in Massachusetts, I don't know how it is in the other states or countries that people are listening to, is that number one, the workforce, it's difficult to find people that are skilled in the biotech industry, right? Like you have to hire people and train them for a really long time before they're effective. And so I know that here in Boston, there and in Cambridge, we're developing a program for non-traditional applicants, so like people who are maybe in like this a second stage of their career, or maybe have not really had access to biotech as like a career in the past, or not even thought about biotech as a career in the past. And I think that the amount of focus on just bringing a more diverse and well-balanced workforce is something that is now happening in biotech, as it is in like so many other industries, right? So I know that that's something you're passionate about. Tell us about kind of like what's lacking, right, from the biotech industry, right? And then also what you hope would happen in the future.
Yeah, Dr. Also, this is a great question that I think about often. I want to take it to a deeper level in terms of diversifying biotech thought leadership, because it's one thing to diversify the workforce, but there's a pyramid, right, in a biotech, and you have people working, but then you have decision makers. And what I want to see is more diversity of folks who are making these decisions, because diversity of thought contributes to innovations. There's several studies that show this and demonstrate this. So what we need to do is create a pipeline where we give opportunities to historically marginalized communities for a chance to take a risk, to fail, to learn, right? To gather these learnings in leadership and have opportunities to grow their careers in the biotech space. It's a very difficult problem, Dr. Awesome, because there's limited space, but there's limited opportunities. But my objective is to really create those opportunities through entrepreneurship and take a risk on individuals who haven't traditionally had that opportunity, because this has been my experience. And I'm excited to open doors for others, because this is how we contribute to innovation. This is how we scale these technologies to really help all humans, regardless of race, gender, or socioeconomic background. So this is something I'm really excited about. And I don't have all the answers. I'll be the first to say that, but I think we need to be action oriented and really be transparent in how we plan to meet these objectives with each other.
So if you were to talk to like a young kid that maybe is good at science and was thinking about biotech as a career, but then their parents are telling them, you know, for something more traditional, like you should become a doctor, you should become a pharmacist or something like that, what would you say to that kid? What would you say in regards to what he should do, like what his career trajectory should be, but also, you know, like kind of what advice would you give him?
Wow, that's a great question. I'm trying to put myself in that position because I wasn't really inspired to do biotech, but at an early age. But what I would tell this person was to say, you know, sit back and listen to what feels good to you. Listen to what you feel the opportunities are for you to best leverage your talents and which you naturally piques your interest, because whatever you do in your career, whether it's biotech or medicine, you want to do something that makes you happy and that gives you the impact that you're trying to achieve in the world. So what are some practical things I would tell them is, hey, I'm not going to just tell you things. I would want to try to point you to resources where you get laboratory experience, talk to other folks in the industry and make those connections, because I think paying it forward is the biggest thing we could do. People in positions of authority or power, we all have authority. Whether you like it or not, we all have a position of power. We can help someone. So for me, I would point them to those resources to get the basic knowledge they would need to get into the biotech industry. What exactly do you want to do? It's broad right now. Let's narrow it a bit or expand it, you know? But I would really try to point to people who can actually help this person get to the next level and give them those tools, right? The tools they need to progress in any career.
Yeah, I think mentorship is huge. I totally agree with that sentiment. Like I was telling you, like I don't think that I would be in the position that I was had I not shadowed somebody that was doing exactly what I'm doing right now. And I don't think that there's a lot of opportunity for especially young kids to see what really high functioning career is like, you know. It's because we're working all the time. Like I'm not interested in babysitting some, you know, person that might be in high school or something like that, but I think it's important. I think we should. I just don't have quite the access to that kind of mentorship that I would want for somebody like that. And I think that the other component of this is also like people who might be like working in the lab, right, and they have something that they consider to be interesting. You're kind of doing this other thing, which is you're starting your own company and you see like some sort of economic value from it, right? Like, how did you make that transition? Because I feel like there's a lot of people out there that are doing the grunt work of the biotech industry, which I really appreciate. And those people are super important. And I think, to be quite honest with you, I think it's like a good work-life balance, you know, like if there's something that I would say that's really interesting about the difference between my field and some field like that is like I can't turn my field off, right? For life sciences, like you do your work and at the end of the day, then you can just, you know, be a dad and be a husband and be all these other things. But entrepreneurship is not like that, right? It's you're on all the time, and making that jump. What would you say to somebody that's just kind of doing tabletop research and wants to make that jump but might not have the idea of how to do it?
If someone wants to make that jump, I would tell them to first find opportunities to get into this space that you want to. If you already have a scientific background and been at the bench, you could work at a startup, right? And understand the business of a startup and figure out, hey, how do I transition from just being at the bench to having a voice in the field? Or you can go into consulting. It's sort of bespoke to what that person enjoys doing. But for me, to answer your question, I've been excited about science a long time in my life, but I wasn't so excited about the mechanisms and the signaling, but what you could do with science. I was always a big picture person. I was like, wow, for example, for CRISPR, right? If you could figure out how to edit the genome, you could potentially cure blindness, which they have clinical trials going on now. You cure sickle cell. I was always a big picture person. I knew an avenue to get these technologies just from the bench to people hinged on innovation and business development and really understanding what ideas are commercializable and what ideas are good research tools. So this is what always fascinated me about science. And early on, yeah, I went there, I did my experiments, but I was always big picture minded because, similar to yourself, Dr. Awesome, I've always been a people person. And I've always wanted to leverage my scientific acumen to bring solutions to people. And the way I see myself doing that is using my mind to recruit, to build ecosystems of innovation. And this is what really excites me about the broader impact of the life sciences objectives that I'm trying to achieve.
So I guess my question is more like the nuts and bolts, right? Like you have this guy and he's working at a lab doing amazing stuff. Maybe he's, making a really nice salary for his family, but he sees some value in what he's doing outside of just looking at a microscope all day, right? To make the jump from like a steady income to,
Mm.
I'm honestly not sure how a startup makes income, just because it's like not my field of expertise. Like, did you start out as like this something you were doing on the side, and then like once it achieved like a big enough following, or I guess like critical mass, like then you started doing it full time? Like, how does one go from like that jump? Because I feel like that's what I hear a lot of people's hesitance. Like, for example, my field, it's very steady, right? Like I get a paycheck from the hospital and I make enough to feed my family, which is great. And that's personally, that's all I'm interested in. But I know I might have a family member that also has that similar career trajectory. And for them, they might be thinking about doing this thing, but they don't understand like the nuts and bolts of like how to do it, how to make that transition from being an employee to being self-employed.
Yeah, yeah. That's extremely difficult and it's hard, right? If you have a family to feed, it's not practical for you to leave. Silicon Valley has all these stories. Oh, I left my job. Yeah, well, this is an access issue, right? You probably have family, friends, parents who can help support that transition if things don't go right. But for a lot of folks, the majority, we don't have that option. So my advice would be slow and steady wins the race. I wouldn't recommend quitting your job that you're feeding your family with, but I would say you can increase your knowledge. You can expand your network. You can plan that life that you want to by carving out time in the day to achieve those goals, right? You could wake up a little earlier to say, hey, maybe I should talk to a patent attorney and get some advice about how these things typically work. There's so many free services that will give you some advice and pointers, even some funding, right? Depending on how far along your idea is. But in the beginning, it's tough because this is precisely the situation I'm in. I haven't raised a ton of money for my company. It's still early. We've made progress. We have some small fund. I'm still working, my day job to build these things, right? Mm-hmm. Eventually, I see myself doing this full time, right, upon our first raise and when we start really running along the way. But you have to do both. And, it reminds me of people like Einstein, right? He was at the patent office for 7 years, at his cobbler trade while innovating, right? Mm-hmm. So people do both all the time. Jeff Bezos built his company while working. So this narrative of you need to leave your job to really build something, I feel like is entirely false. And it comes from a privileged sort of perspective, but we shouldn't feel that pressure. So my advice would be to take it slow. And believe me, I'm in this boat where I want things to move so fast that I don't have to work and continue to do this. But a lot of late nights and early mornings trying to make this dream come true. And I haven't been in, this is the happiest I've ever been. So I feel like it's the right thing.
I think we were talking earlier. It's like, once you figure out that this is what you were meant to do, it stops becoming a job, right? And just starts becoming a calling, which is sort of how I feel about my job. Like I would never want to jump to another field or profession, but I know that there's a lot of people out there that see, what's happening in biotech. They want to start their own company. They're just not sure about like how to do that. So I wanted to ask you that because you're kind of like in the mix with that right now. But also, I just wanted to zoom out again with just biotech. You're in the field. There's a lot of amazing things happening now, and I'd love your take on them. Like specifically the idea of genetic editing, which is something I feel like I've always been interested in because my background in surgery is craniofacial disorders, and for a lot of them, they're genetic issues, right? Like, so if we could change the genes, then they might not have the symptoms later on in life. For whatever reason, I see the sickle cell one where this disease could potentially be eradicated, which is a genetic component to it. They had this familial hypercholesterolemia study that was stopped prematurely because of, for whatever reason, I was talking with another geneticist that there was like in the past, like a lot of negative aspects to gene therapy in the past. Now it's a little bit more bespoke and much more targeted. So a lot of these things that happened in the past are not happening. But is this something that potentially could cure all genetic diseases? Is that something that people truly believe in the industry, or is it something that they're like, well, we're not quite there yet? I don't know that as like an outside observer, because I would love to hope for the future where genetic issues can be cured before they start causing problems. I just don't know if like that's something that's realistically going to happen within our lifetimes. How do you feel about it?
Oh, I feel that it's already happening, right?
Mhm.
You can even look at Bridge Bio, looking at monogenic disorders and cancers. So cancers and different diseases that are caused by one gene, right? They're using different gene editing modalities already to cure those diseases. And also, we've seen this with CRISPR with sickle cell, right?
Mhm.
There's clinical trials, usefulness of CRISPR gene editing in blindness already, reversing aging in dogs, right? So I see this as a field that's going to continue to grow, but there's still limitations for off-target effects, right? Sometimes these therapies can cause downstream cancer. This is what's happened in different clinical trials. So I see this as a field that's going to continue to evolve, and not just direct gene editing, gene modified or gene expression agents like siRNA with Alnylam right up the street. They're making huge advancements in the treatments of different metabolic disorders. So I think gene editing continuing to evolve. I still think we're years away from seeing it as a mainstay in therapeutic options. But what a time to be around! What a time to be in the epicenter of innovation as we continue to develop these novel technologies. But I'm really excited to see where the field goes in the next 5 to 10 years, but I do see a major play in different modalities in gene therapy, a resurgence of adenovirus delivery modalities, but also liposome delivery modalities, because a lot of these issues, technology isn't so much the big bottleneck, is delivery. How do we deliver these bespoke technologies specifically to cells and limit off-target effects? And I think the field is moving towards answering these really critical questions about how do we get these great molecular payloads, these genetic payloads to this disease cell, but not only that, how do we maintain this bioactivity when it gets there, right? Because you can imagine once this therapy gets to a cell, there's all these different mechanisms that chop up foreign materials and things like that. How do you evade these processes and get it to a targeted cell? So I see this as continuing to evolve and shape our industry.
Interesting. Do you think we're going to cure Lyme disease within our lifetimes?
That is a great question. So antibiotics does a good job for a lot of people, right? But we still don't know how these spirochetes really interact with the immune system. I mean, they're so tricky. They hide between the interstitial fluid of your skin, and they're so sparse. They're not like very abundant. So it's really hard to characterize where they're at. Like you mentioned earlier, you're checking all the organs, right? Because it disseminates quite rapidly. So finding a cure to Lyme, I think we're making some progress, but I don't think we're going to get there till the next, 5 or so, 10 years. But what I'm excited about, Dr. Awesome, is that people from outside the field of Lyme, like myself, Jeff, my co-founder, different expertise, are starting to contribute their expertise to the field, which was absent for the past 20, 30 years.
Yeah.
This is what we need in science. We need to create diverse nodes of expertise to attack problems that traditionally weren't looked at it this way. And so I think Lyme is an example of this, where a lot of people that are in systems biology, bioengineering, physics, different disciplines are starting to say, hey, how can we leverage our expertise to really find a solution? So I see Lyme moving quite rapidly because of this.
Yeah.
And I'm really excited to be a part of it.
Yeah. I got to ask, because, I did a lot of research before today's podcast. Have you heard about this conspiracy theory about Lyme disease?
Oh, I've heard a lot.
About how it like started out as like a bioterrorism weapon and like just like accidentally got released. I thought that was like super interesting because, well, my wife, her family is very close to Long Island where this Cold Harbor plant is. And then it got supposedly released across the bay to Lyme, Connecticut, which is how it has the name Lyme disease, which I think, first off, I want your take on it. Like, is this like all just BS. But number two, I think that's what a lot of people have fears about when it comes to biotechnology, right? Is that like this could get out of control. I mean, it's also the conspiracy theory behind COVID, right? It's like this is potentially like research that has been disseminated by accident, right? What do you say to those people like that have a lot of fear associated with like these biotech advancements? Because I'm sure that the Lyme disease thing was something that like I wasn't really expecting when I started doing research for today's podcast, but the pandemic thing, I mean, it's like, almost national media right now, right? It means something it's out there. And who knows if it's a conspiracy theory or not. But the fact of the matter is that there's a real fear that people have about biotech advancements. And I think that we're both in the same boat, that we have a lot of optimism, a lot of hope about what biotech has to offer. What do you say to those people? And also, do you think the Lyme disease conspiracy is real?
I'll answer the same question. I don't think it's real.
Yeah.
I need to look more into it, but I don't try to focus on these conspiracy theories. I'm trying to focus on the people. And from what I've read, I don't really believe it. I can't really verify. I can't unverify it.
Mhm.
So I try not to, because I could be up all night thinking about it if it's real. What I'm concerned about is how can we put our bright minds together to outsmart these ticks? Like I always say, what the hell are they good for, right? Like
Yeah, I
they
know.
suck blood and give diseases.
Yeah.
And so I want to understand, hey, how can we leverage their properties for therapeutic and human needs? And how do we get rid of the impact that they're having on the entire world? To answer your first question about how do you calm worries about this? I mean, with every technology, there's potential for good and bad, right? Cars are great for driving, right? But they can be used to hurt people. They can be used to do things. So technology always has a good and a bad. And you're right. It depends on whose hands it gets into. But what I am hopeful for, what I'm excited about is that we have regulatory bodies. We have multiple people who are involved in the process of the manufacturing of these therapeutics that ensure safety. In the past, it hasn't been perfect, but we learn from our mistakes, right? We learn how to innovate and become better as a humanity and as a society. I'm willing to bet on the usefulness of these technologies over their potential harm. I'm willing to take the risk to be a part of that innovation because I feel like there'll be much more good than harm caused if we continue to work together with the right mindset.
No, I agree with you 100%. I just know that like I have to have conversations with patients that are a little bit hesitant for treatment. I have to have conversations with even family members that are hesitant for treatment. My tactic is always to use science as a defense mechanism when it comes to speaking with people that are hesitant about treatments that I have to offer, right? Maybe biotechnologies that they might not understand. But I've come to realize most recently is that is not effective.
Yeah.
Like I can hide behind the science as much as I want, but they're never going to believe it. Right. So I didn't know if you had like some other tactic. I don't know if you had, I'm sure that you have those same kind of conversations with people that are in your orbit, because people that are in science like ourselves, we still have to interact with people who are not in science. Right. And so what do you say to those people? Is it different for them from what I have to say? Or do you have any other tactics that you use when you're talking to people who are a little bit more fearful about either different technology they understand or even the future of biotech in general?
I try to understand before I give a solution. I try to listen. And I feel that if we listen more, we would realize a lot of the things we're worried about are kind of the same. So I try to listen, but sometimes, you can't get through to people no matter what you do. So I feel like it's better to listen. I have family members and friends when they talk about the vaccine. My godmother said, "Hey, did you take the Jamba Juice yet?" And so it's like when you're coming from that, it's like you already know how the conversation is going to go. So I want to be a connector of people and I want to just create conversations. Like my job isn't to really convince you, but I just want to expose you to a different way of thinking. And if you think it's still like fishy, that's great. But I want to hear where you're coming from. And my tactic is just to ask questions about why they think. It's almost like the Socratic method. Why do you think this? Why do you think there's a conspiracy? Well, this happened in this era, this happened there. Okay, great. Like what was the context of that? And what about the positives we see? Like, right now you're taking XYZ medication and you see the benefits. So I try to humanize everything and have a conversation because most decisions we make are emotional, in my opinion. And so I don't have all the answers. And there might be some valid things they have to say. So I just try to listen, create dialogue. And I think that's the best way to convince somebody it won't happen overnight, but it's going to come through dialogue and community building and exposure. So that's the sort of the approach that I take when trying to convince naysayers, I guess.
Yeah, yeah. It's tough. I mean, so I deal with like a lot of kids and the parents, right? Like there's always studies that are out there that refute other studies, right? Like, I mean, and it's very difficult to even ourselves, I think, parse out the quality of evidence, right? Personally, I think the COVID vaccines were in general a good thing, but on the same token, like there are known side effects that have been underreported. And so that's something that we have to reconcile with when we're talking to patients, right? Like there is that mentality of this thing that affected all of us where I feel like the verdict has not been written yet. When I'm talking with parents, it's not only the component of the science and like, this is what I think the best thing is for your kid, but there's also the emotional component. Like, what if you're wrong? And I'm always looking for people, especially in the biotech industry, to see like how do we get rid of some of the pessimism that's associated with advancing technologies, because I feel like that's something that persists in any new technology, like whether it's artificial intelligence or nuclear fusion. There's always like this segment of the population that is pessimistic about it. It's interesting to hear your take on it, because I'm sure that you've had people that have come to you and feel like you have to convince them, right?
I've already lost my hair. I don't want to lose more of my hair trying to convince someone who's firm in their belief. But this is the disconnect, right? Between the scientists, the medical practitioners. There's a disconnect between lay folks and the type of science they're doing, what they're doing. There's a disconnect in the communication, because if people were exposed, I always believe they're exposed and spoken to in a manner that's respectful, where they can understand that you can agree to disagree on something, but acknowledge, like you mentioned just now, Dr. Awesome, that there is some validity. A lot of science is refuted. There are a lot of side effects that affect populations, that this COVID vaccine isn't safe for everyone. So acknowledge that, be upfront with that. And I think that will garner mutual respect and eventually, hopefully, a turn in sort of how people view biotech and the future of biotech with less pessimism.
So we're getting close to the end of our time, and I really appreciated you coming by. I think we really had a lot of interesting things to talk about, but I do want to just get some general questions out of the way, because it's something that I do with all of my guests. I want to know kind of where they're coming from, where their inspiration is, what they see for the future. So starting with all that, I always preface a lot of my conversations from a standpoint of somebody that's a hopeful optimist. And a lot of that hopeful optimism comes from science fiction. I look at, series like Star Trek and, Isaac Asimov as some of the best ideas of what the future holds for us. Where do you gain your inspiration from when like you're obviously, doing this novel thing and you want to make sure that it gets to fruition? You have to have some sort of inspiration that's driving you. Where do you get your inspiration from?
I really get my inspiration from my past. I see the people who came before me who were from historically marginalized backgrounds, who figured it out, how to contribute to innovation. The George Washington Carvers, the many innovators who didn't have resources, but paved the way for people like myself. So for me, I would be remiss if I didn't leverage the opportunities I have to give back, the intellect that I have to contribute to innovation. So I just am reminded of the innovators that have gone before us, the hard work that they've done. And I want to channel that energy to make an impact that's going to be a long-lasting impact. So that drives me every day, and the sacrifices that were laid before to get me here. So yeah, those are some of the things that inspire me.
Yeah, I love George Washington Carver as an example. And honestly, I think the whole concept of a Renaissance man is something that, for whatever reason, it's like almost like kind of looked down upon these days. Like if you do too many things, like somehow like that's like a negative. Like you have to have this one career trajectory, and it has to be like from this school and this field, and then you get here. And I like to think like Anton Chekhov, he is one of the greatest Russian playwrights of all time. He was a physician. You can do a lot of different things, like it, and the concept of like what you're talking about, like you can have a day job and still be promoting, your business and like trying to do this really amazing thing. And once that gets big enough, then you move on to that thing. And then once you're done with that, move on to another thing. I think that that's something that I really love about what you said. And I hope that a lot of people take inspiration from that, because That concept, I think, is like a really big deal. Like you don't have to be limited by just one singular career or one singular trajectory. Like the whole concept of career is different now. It's just not, it's not linear the way it once was. So I really hope that for those of you guys who are on a path, like you realize that there's multiple paths. Like that's something that's really inspiring to me when you said it. But specifically about technology, I wanted to talk about biotech and kind of where you see the field in 10 years. We're in the midst of some really amazing technological breakthroughs. How do you see that permeating into the life of an everyday person that might not be in the field? You might have more investment, you might be running your own company in such a way that you have thousands of employees and the ticks or diseases are a thing of the past. But specifically for like the everyday person, what does the biotech field look like in 10 years for them?
I think two major advances will happen in the next decade. One is the acute diagnosis of predispositions to cancers and different immunopathologies. I think with the advancement of AI and accelerated drug delivery bespoke for each individual, this is only going to become more robust, more precise. So the first thing I see is the acute diagnostics of different cancer and immunopathologies prior to disease onset is becoming a thing that's present in the everyday lives of individuals. Almost sounds sci-fi, but I see the direction of biotech going in that. I see biotech going in that direction quite rapidly. A second thing is advent in the use of allogeneic stem cell therapy, right? These off-the-shelf stem cells. Right now, when people are getting these cell therapies, CAR T, we talked about CRISPR, they're autologous, right? They're from their own cells. So imagine your immune cells are depleted and you have to wait for enough cellular material to re-inject back into you. You imagine how dangerous that is. You don't have an immune system. You could die. You can have long-term complications. But now the field is moving towards these off-the-shelf stem cells, which can be readily available. So if you need a cancer treatment or a bone infusion, there'll be cells readily available for you. You have to think crazy, big, outside the box things, but these things are actually happening. And I see the next decade will have this be a reality for the everyday person for whatever element that they have that is bespoke for them. So long time from now, but not really.
Yeah, no, I don't think so. I think that all of the technological building blocks are there. And I know firsthand how difficult that process is. My mom had a bone marrow transplant when she had leukemia. And those few weeks where she had zero immune system, those were a harrowing few weeks,
Yeah.
And so I look forward to that day. I think stem cells in general, I mean, a few weeks from now, just a few blocks from us, Yamanaka is having a talk. He's like the guy who developed these Yamanaka factors, reverse cellular lineages, which is really interesting. But I think that is a really exciting thing to think about, where the ability to have off-the-shelf biological products that mimic the human mechanisms that are already present. I think that's going to be really amazing. So I hope to see that, because there's lots of people that would benefit from that. Like even patients that are undergoing surgery, like there's certain patients that you can do the best surgery in the world, but they're just not going to heal because they have poor protoplasm, right? And I would hope that there would be different advancements for them so that we could help their healing process, not just people who are undergoing these really difficult diseases. But last question, we talked a lot about biotech today. I think that the future is advancing so rapidly in a whole bunch of different technological aspects and scientific aspects and even understanding aspects, right? What are you most excited about when it comes to the future in regards to things that you're seeing in the paper, whether it's technology, whether it's science, aside from biotech, right? What interests you and you're like, oh my God, I can't wait until I get that. And I can tell you, I can preface the question by telling you what I'm interested in, which is robots, right? I can't wait until I have a robot that can fold my own laundry. Like that day, I'm going to be the first person in line for that robot, right? What about you, Joe? What are you most interested in?
Well, so many things. I'm really interested in sort of understanding the stories at a genetic level from our ancestors. I know that sounds crazy, but if you think about it, the germline is immortal. The germ cells you have, not the cells that make up your skin, but your sperm, egg cells that make you, these are passed on from every generation. I've always wondered, what were the real stories? What were the real struggles that our ancestors and people before us went through? What were the achievements that we don't know? I live in this sci-fi world where we can look at the genetics and how those genes are modified and tell stories about the experiences, about our ancestors and how we can
Interesting.
use those to inform our future
Right.
and different things. But I think about things like that. I think about inclusive ecosystems of innovation, how we can merge those things. But those are sort of the wacky things I think about and some of the normal things I'm
That's
excited
cool,
about for the
man. It's like
future.
ancestry.com on steroids.
Ancestry.com on steroids,
Yeah,
exactly.
interesting.
Yeah.
Well, thanks so much for coming by. I really appreciate your insights, and all the best of luck to you and your future with your company. I think the most interesting thing that we talked about today was just the idea of you can do a whole bunch of different things. I think that whether it's me doing surgery or whether it's you building a company, like there's so many different things and we're so multifaceted. And I've really learned a lot about that from you today, because I really like the biotechnology aspect, but we commented on so many different aspects of biotechnology. So thank you for sharing that insight with us.
Yeah, thank you so much for having me, Dr. Awesome. And please, anyone feel free to reach out to me to collaborate. If you want to also, put it into tick-borne diseases or talk about biotech inclusion. But thanks again for this opportunity. And I really loved our discussion and excited for the future.
Yeah, man. And come back anytime.
Yeah.
Thanks everybody for listening to us today. As always, if you could just hit the like and subscribe button, we would really appreciate it. And for those of you guys who listen to us on a regular basis, we will see you again in the future. Have a great day, everybody.
We appreciate you taking part in today's episode. Take this chance to reimagine a better future by joining a community of futurists who strive for a remarkable world. Be a part of this growing network and contribute to making the world a more positive place. Visit thefuturistsociety.net and subscribe to the show so you don't miss a drop of hopeful futurism.